up, and we're back. And what we're going to focus on is very similar to the last video I posted. A kind of workout for the day if you're in the hospital. Maybe you just don't know how to get moving, whether that's in the hospital or even at home. The exercises we're going to be doing today are about kind of get things moving, maintain that strength, maintain that endurance, especially if we're in the hospital for a couple days or even a week or so. Like we've already touched upon in the past, is make sure you talk to your medical team before doing these exercises. That includes your physician that's in charge of your care in the hospital, your nurse, making sure that they're aware, your physical therapist, your occupational therapist, just making sure the whole team's on board before you do these exercises. You know, if you might have certain precautions, like maybe your vitals are off, your lab values might be off, or if you just had a surgery, they don't want you doing certain movements. So just make sure you clarify with the medical team that you'll be doing some sort of exercises within your room. Now, all of these movements are only going to be for about 20 seconds, and I'm going to walk through them with you. So instead of talking each exercise out, we're just going to go ahead and jump into it. All right, make sure that you're warmed up. Hopefully you did a walk or two, a couple laps around the floor, and then we'll get right into the workout of the day. All right, let's go. All right, guys, we ready? So there's 4 movements. Each movement is 20 seconds, and then the 5th kind of set of exercise is rest. So 4 exercises, 1 rest, and that's 1 round. Okay, we're gonna try to shoot for at least 3 rounds. All right, so first we're gonna just go into side stepping, and we're gonna be doing this for 20 seconds. All right, ready, set, get down a little squat, and go. All right, so with this movement, I like to get down into a little bit of a squat just to kind of activate those quads, activate those glutes a little bit. Nice athletic stance. Now with these exercises, like we've talked before, you should be pretty independent. You don't want to be doing these if you're requiring like an assistive device and stuff, or a walker or anything like that. All right, and then we're going to go straight into marching in place, all right? And 20 seconds on this, and go. So like we did in the last video, making sure you have good posture, keeping those legs nice and high, the knees nice and high. Each movement you're kind of contracting at your hip, but also at your core. We want to try to make this a holistic approach, activating all muscles that we can. And stop. All right, then we're going to go right into lunges. And go. So with this, just do forward lunges and a nice push back, especially if you have limited space. This is easier than doing walking lunges. Now with these, you can modify. You can do a little, just step forward, step back. You don't have to go straight into a lunge. And step. Whew. And the last one that I want you to do is you're going to do wall push-ups. Now, figure out a good wall in your hospital room, or even the end of your bed, making sure that it's locked. Just something where you can get some leverage to push your body up. So, and go. So I'm just using the end of the bed here, which when you're closer to the floor, it's gonna simulate like a more regular push-up. But doing a wall push-up is perfectly fine. It's gonna make it a little bit easier, as well as manageable in the hospital room versus doing an actual push-up on the ground. And stop. And now you're gonna go into a 1-minute rest. All right, take a break. Get an idea of how you feel. I'll get this up. Get an idea of how you feel. Any sort of symptoms, dizziness, nausea, feel like you're gonna pass out. Anything like that, obviously take a break. Call your nurse. Making sure that everyone knows kind of how you're feeling. Now with these exercises, they're all you can modify them in any way. They can be adapted to your function. So with the marches, for example, maybe you have to hold on to a wall just to kind of counterbalance. With the lunges, maybe you're not going all the way down. You're just doing a little partial weight shift forward. That's fine. The purpose of these exercises is just getting you moving. You know, we get You know, whether you're going through an infection or specific treatment in the hospital, we get weak by just being in the hospital. So this is a way that it breaks up the monotony of the day, as well as it just kind of maintains that strength that you had prior to coming into the hospital. All right, that was one round. So I'm going to do one more round with you, and then ideally you want to be able to do 3 or 4 rounds of this exercise. All right, again, 20 seconds on each exercise. We're going to start with the side stepping, okay? Nice athletic stance, 20 seconds, and go. Again, with this movement, you don't want to be too much crossing of the legs. It's more just kind of like a defensive basketball slide. We're not going fast. We're just kind of waking those muscles up in our legs. 5 seconds here. And stop. A way you can modify that is just going up and down like a railing on the side of your bed if you need something to hold on to, or even like a counter. All right, right into the marches. 20 seconds. Let's go. Nice posture, nice high knees. Again, I'm not looking for speed. We're not trying to get that high velocity movement. We're just kind of working things, getting that blood flowing, getting our activity level back. And even you can tell I'm breathing, so. And stop. All right. Now, last movement, right into those lunges. 20 seconds, or not last movement, third movement, 20 seconds. Ready, and go. So I like to have my hands just kind of up. Some people do this. Again, you don't have to go too far. I'd rather you be safe. So if you feel like you're having some weakness in your legs, just do a little step forward. This is fine. Just to get that weight shift. Perfect. All right. And then final movement, you're gonna go right into the wall or end of bed push-ups. And 20 seconds, go. This could be pretty tough, especially if you had weakness or maybe you have an IV in your arm. Now, in your arm here, especially in the arm here, 20 seconds stop. Maybe limit that. There's other things that we can kind of do, especially when you're going on an incline here, that might be a lot of pressure on that arm. So maybe we have to modify things. All right, so that's round 2. So then you have another minute rest, and then you would go straight into round 3. So again, this isn't taking like a ton of your time, but breaks up the day, as well as it kind of gives you something to do besides just walking around in the halls. But some of the patients that I've specifically used this for are obviously patients that have been in the hospital for a week or 2, and they're just kind of overall deconditioned, even if they're in their 30s, 40s, 50s, up to 80s. If they were independent before, maybe they don't need an assisted device. This is a good way to kind of jumpstart things to get them back and moving. But also, I've also used this specifically for patients like after a stem cell transplant. So they're kind of confined to their room. They might be able to walk the halls, but they're not able to do too much. They might not be able to go outside, things like this. So this is a way, which is imperative, especially for those patients, to just continue to move, continue to maintain. Again, it's about maintenance. We're not like going to build big muscles through this, but we're maintaining what you have. All right, so that was a long time. So that was a minute break. All right, so I want you to repeat that 2 more times. All right? You're on your own. Go. Did you get round 3, round 4? You did it. That's awesome. I'm proud of you. Like, to just be able to be motivated enough to do this, that's a big deal. Now again, these exercises, they're more for those patients that are walking around the floors. They're pretty independent. They're just looking for a way to kind of break up their day and to maintain their overall mobility. Now, again, you should talk to your medical team, talk to your physical therapist, occupational therapist, speech therapist, the physician, nurse, whomever, just to make sure that this is okay. Because if you have specific precautions, you don't want to be, extending your hospital stay. Also, if you're requiring like a walker to move around the hallways, this probably isn't the best exercise routine for you. And I might have videos later on in the next couple weeks geared to patients that might require more upper extremity support. Now, if you're a physical therapy, OT, speech therapist out there, and you're watching this video, this is a good way that you can kind of just be like, hey, here's this link. And it's a way that you can give patients exercise, and I can, I talk through the exercises with them. So it's a little bit more motivating sometimes than just the printout of exercises. So there's different, uses of this video. That's kind of why I started doing this, because I know there's often a missing piece. I was an acute care therapist, I would give them exercises. Did they always do it? Most of the time, no. And sometimes they weren't always, as challenging as maybe the exercises could be. So this is a way where we can do almost like an interval training with the more independent patients to make sure they're not losing too much strength or endurance. But I appreciate your time today. I really do. And I'm excited to continue this journey. Hopefully my hair and videos get a little bit better and situated, obviously. But I appreciate your time, and I thank you for joining in and watching this video. And I hope this helps someone out there. I'm from Power Motion Rehab, and I hope to see you soon. Thank you.